And are we working off this one?
This one.
Right. I'm just got the
Patellar surface now. So where's the patellar surface?
patellar surface. Yes, where it's articulating with.
Where the patella would be moving. I wouldn't say stays there because obviously it moves up and down. So where it would be contacting or coming in contact with it. And you have the medial and lateral epicondyles. See them bust from the side. So epi means above. So you have two terms that you have to know, or actually four. So you have a condyle and you have an epicondyle. Epi means above. So this is the epicondyle of this side, this is the epicondyle on this side. Now, how to tell which one is lateral and which one is medial? You guys have any idea how you can do that?
Just by the position of the bone, and that's going to be medial because that's going into the hip joint. Well, right?
I was holding it back.
Oh, that's right.
So, you're recording, so I'm just going to ignore it.
Okay.
So, one of the most important things when it comes to studying and when it comes to taking the test is orientation.
Right.
Always orient yourself. Because I was holding it like this to show you the back side of it.
Right, yeah, that's the back side, yeah.
If you didn't notice that it was backwards and upside down, it wasn't really, but you would get mixed up with which side is lateral, which side is medial. So always orient yourself. That's the biggest thing that you can do during a test and as you're practicing. Because I don't know if you heard Dr. Crow, you won't be able to move or touch the models that are on the table. Because what we will do, we won't have 50 TAs sitting in here, pointing at a part and telling you what is that. What we're gonna have pens and stickers and other random things to tell you which part we're testing. So for example, we can have two stickers here or one sticker here, and you would know that's the head of the femur. We can have pins going down. We're gonna get to the linea aspera. We can have a couple of pins, and you have to identify that that's the linea aspera on your form. Now the thing is, the reason you can't hold it is, well, what if those pins fall off? It's not fair for the person next to you and the 49 people behind you. So that's why you're not allowed to touch the models, which means you have to orient yourself. If a model is sitting there like this, you have to be able to orient yourself. So that's crucial. So one way I like to orient myself when it comes to the femur, first think which side is anterior and which side is posterior. So you can kind of tell from the patellar surface that it just looks different, that the patella will be resting here versus you have the popliteal surface right here where you have the screw. So that's one way to first identify which side is anterior, which side is posterior. Then once you identified that, okay, this side is anterior, the head tells me that the head is always medial. So when you look at the model, the head, the way it attaches to the pelvis, it always has to be medial to the rest of the bone. So you always remember that the head is on the medial side. So now we are just established that the head is on the medial side. So now, what's your name? Molly. This is an epicondyle. I'll give you that. Now, is it the medial or is it the lateral?
The medial.
Why?
Because the head's on that side.
Exactly. What is this?
It's the lateral
epicondyle, good. And now the next two terms are condyles. You have a lateral and you have a medial. Same exact logic. So this right here would be your medial, this would be right here is your lateral. The other thing is, I don't know if Dr. Crow mentioned in class, your pictures are always 99.99% of the time are going to be of the right side, of the right extremity. So whenever you see a picture of one femur, of one bone, of anything, if there's two of it, it's going to be the right. That's just an established thing when it comes to textbooks and anatomy in general. But here's the thing. This side is which femur is this?
That's right.
That's right. I could very well go and grab a left femur, and that would very well confuse you. So study both sides, because you will be surprised how small things like changing the left versus right can actually confuse you. So I was working with another group just previously, and they were just so confused because I accidentally, not purposely, picked up the left femur and they had in front of them the right femur, and they were just so confused as to why are things the way I'm saying they are. Well, because everything is backwards. So always remember that side matter and orientation matters. Okay, so that's enough of enough with that. Okay, so we got the epicondyle, then we got the condyle. So we have the gluteal tuberosity. So gluteal tuberosity is going to be back here. It's this more or less bump type of thing right here. So tuberosity is just a fancy anatomy word for a bump. It comes up 101 times.
And it's on the back side?
Yep, it's on the back lateral side.
Although Schrader has some great places.
Yeah, Esperanza. That's
You
the
already
long.
mentioned that one, so it's this line that runs down here. This line. So one thing is people ask, well, how can you tell the difference between the gluteal tuberosity and the linea aspera? We're not going to trick you. We're not going to pin the linea aspera here, and we're not going to pin the gluteal tuberosity here. We're going to make it. We're not after you. We don't want to make your life difficult. We just want to make sure that you guys know what the terms are. So if we want to, pin or mark the gluteal tuberosity, we'll do it probably somewhere up here, and linea aspera we'll do it somewhere down here. So know that we're not out to get you guys. Although sometimes it may seem like it. Okay, popliteal surface is just the surface right here. And as you learn more muscles, you'll recognize that you have a popliteal fossa and popliteal artery, which is why the region below it would make sense to be called popliteal surface.
I don't know if this is allowed to ask, but would it be okay if you started from
Go
here
through it.
and go
Not a
through it and I
problem,
videoed?
Yeah, that's.
I could get.
No pressure.
That's.
I won't do your face, but I don't know. What's your name tag?
Oh goodness.
You know it better than
Depends on
us.
where you're gonna post it. If you're gonna post it, then my name better be on it.
Okay.
This is like copyrighted. Okay, so yeah.
You are going on my YouTube channel. So.
Okay, so we'll just do. So we'll just do the terms that we went through right now. So this orientation. So you have the head right here. You have the neck. It's posterior. You have the greater trochanter right here. You have the lesser trochanter. You have on the anterior side the patellar surface. And you can look at it actually from both anterior and posterior. You have the medial epicondyle right here, and then you have the lateral epicondyle right here. You have the lateral condyle here, and the medial condyle here, and the lateral condyle here. We have the linea aspera up here, and we have the gluteal tuberosity up here, and then we have the popliteal surface right here. That's everything. I don't work well under pressure.
You were great. Thank you.
Alright, so why don't you guys study that for some time? I do have to take this one back, but I recommend that you take this apart. I didn't tell you you can, but you can. Just make sure you don't lose the pieces. And again, I recommend